Hello, my name is Aline Sigler, and I'll be one of your hosts today for this special event. Also on the line with me is my friend and colleague, Karen Curtis. You'll hear from her a little bit later. Karen and I are members of the Provider Outreach and Education team. We're also pleased to be joined by several members of the WPS Appeals Department. They'll be responding to your answers, or providing answers, to your questions. You can see that the objective for this course is listed here. And to achieve that, we're going to start with a very brief overview of the Medicare fee-for-service process. We'll share some common things that the Appeals Department is doing on how you can give feedback about the redetermination process with WPS. A big part of our time together is going to be spent in a Q&A session. We're going to be answering questions that were submitted during registration, that were sent to us by email, and the ones that you place in the chat. One final note here before I move on is about the disclaimers that are associated with our presentations. They can now be found at the end of the slide deck. So that's another change that we've made recently, and I just wanted to make sure that I mentioned it. For many of you on the line, this overview is going to be a review or a refresher for you. But with the number of people that we have on this webinar, for those of you who are new, or maybe you're just beginning to learn about Medicare and the appeals process, this hopefully is going to give you some background for the rest of our discussion today. As your Medicare administrative contractor, WPS processes claims for original, traditional, or fee-for-service Medicare. You may also hear this called other terms. It's claims for Part A and Part B. Part C, or Medicare Advantage, is an alternative, all-in-one plan that's offered by private insurers. It combines Part A and Part B into one policy, and it often includes Part D prescription drug coverage and maybe other extra benefits like dental, vision, or hearing. Their appeals processes may be different. We can only speak to traditional Medicare. So I just want to make sure that we're clear on that, because we did receive a pre-submitted question asking about the process for Medicare Advantage plans, and that's not something that we can answer. You'll need to consult with the individual plans to be sure that you're familiar with their process. Starting with the definition of appeal. In general, Medicare appeals are a multi-level formal process to challenge decisions about coverage, payment, or services. It allows you to request a review if you disagree with a denial. Once an initial determination is made, any party to that initial determination, such as beneficiaries, providers, and suppliers, or their appointed representatives, has the right to appeal the Medicare decision. The process starts with the redetermination by a contractor, such as your MAC, WPS, and it potentially moves to independent organizations and even federal court. Chapter 29 of the Medicare Claims Processing Manual is where you can read about the regulations for appeals of claims decisions. If you downloaded a copy of the slide deck, towards the end there are a couple resource slides, and there is a link to this there. If you're watching the recording of this session, all of the links mentioned are in the description of the video. Now, not every unpaid claim has appeal rights. So we have the next couple slides here to illustrate and compare the different actions that might apply to your claim. If you build a service on your claim and you feel that it's denied in error, you can submit a redetermination request along with the documentation that supports your denied services and have it reviewed. There's a link on this slide that takes you to the redetermination request form on our website. So if we go out and take a look at that real quick, it's a concise, sorry, it's just taking a second here. So it's a one-page form. It's going to help guide your submission. So if you look through it here, it has all these blanks, and as long as you've filled out all these blanks, then you have all the information that you need. I just wanted to show that to you briefly. It is something that we provide for you. Going back to the slides. Another action is what we call a clerical error reopening. And this is helpful if you need to correct minor errors or omissions on a processed claim. And that would be things like updating diagnosis codes, CPT or HCPCS codes, or modifiers. We have an article on our website, and it has guidelines, and there's a link to it here on the slide. So again, if you have downloaded a copy of the slide deck, you have all of these links. So it gives examples in that article of what can and cannot be handled as a clerical error reopening, as well as instructions for submission. In most cases, if you know what information needs to be added to your claim to make the claim or line payable, you can adjust it. If you're a Part A provider, meaning that you bill on the UB04 or the 837I electronic equivalent, you can adjust and add this additional information in direct data entry or submit a corrected UB04 to our claims department and have that information updated on the claim. If you are a Part B provider or supplier and you bill on the CMS 1500 or the 837P electronic equivalent, you can adjust your claim in our secure portal, which is called the Secure Net Access Portal, or SNAP for short. You can mail or fax your request using the reopening request form on our website, and we have a link to it on this slide here. Now, I'm going to say that using SNAP is a much faster, more efficient option. So if you're not a registered SNAP user, if you don't use our secure portal to do a lot of your claims duties, I really highly recommend it. One last action to mention here is called an inquiry. So for non-overpayment cases, if you're unsure why your claim or line denied and you aren't sure if you should appeal, you can call our customer service line to inquire about the denial before submitting an appeal. If you have questions related to your overpayment, we've listed some department email addresses that would be able to assist you. And they include, as you can see here, the Part A, non-Medicare secondary payer related inquiries. And if you're new, Medicare secondary payer is shortened to the acronym MSP. Part B, non-MSP related inquiries. And we also have MSP related inquiries. So we've outlined these should you actually be an inquiry. So, these processes. So you don't want to submit a redetermination request when it should actually be an inquiry, adjustment, or reopening. And so that's why we briefly wanted to go over each of these with you. I want to take you back to our website for a moment here, and I just want to show you a page that we have. And this is for forms that are related to changing a processed claim. And this link isn't on the slide deck if you've downloaded it and taken a look at it. I apologize, it was something that I added after it was posted there. Karen is going to add the link to the chat for you though. So if you decide to use the various forms, here's where you can find them. So you would go to the Topic Center, Appeals, and then right over here, we have a link to all those different forms. Now this is going to look different depending on what jurisdiction you were in, but I just wanted to show it to you so that you can find them. Now this is a CMS graphic. I took this out of a Medicare Learning Network product just because it has all the different levels in one place. So it consists of 5 steps or levels in the original Medicare or fee-for-service appeals process. So if we read through them, we see the first level of appeal, which we've mentioned, is the redetermination by your MAC. The second level is a reconsideration, and that's done by a totally separate entity called a qualified independent contractor, or, of course, it has an acronym, the QUIC, QIC. Third level is decision by the Office of Medicare Hearings and Appeals. This is followed by review by the Medicare Appeals Council, that's level 4. And the fifth level of appeal is judicial review in federal district court. Now, appeals have to begin at the first level and go in order. Each level, without going into too much detail, has certain steps that have to be taken before appealing to the next level. And if all the steps are met at a specific level, then the requester and all other parties to the appeal decision is allowed to go to the next level in the appeals process if they choose to. Although there are 5 distinct levels in the Medicare appeals process, the redetermination is level 1, and that's the only level that the appeals department at WPS processes, or any MAC for that matter. So your request all begins with a valid request. Not meeting the initial requirements can defeat you before you've even gotten started. The regulations require all redetermination requests to be in writing. Appeal requests submitted electronically via fax or secure internet portal or application are also considered to have been received in writing. So it doesn't just mean mailed or on paper. We just looked at the WPS form, but CMS also provides a redetermination request form, and you can choose to use it, but neither one of those forms is required as long as your request contains all the same elements. Of course, if you file it electronically, all of those same elements are there within the application form. This slide lists items that the appeals staff require and that every request should include. So first, they need details about the beneficiary. They need their name, their date of birth, and their Medicare number. They also need details about the claim, the exact dates of service, the claim's document control number, known as the DCN, and the name and address of the provider of service. In addition, we highly recommend including the provider's phone number. Now, using the provider's letterhead is an easy way to include all those items. Let us know the specific item or services you're appealing and the reason for the appeal. We need a clear explanation of why you disagree with the initial decision. They need requester information. The requester is not always the provider. We need the requester's name and contact details, or your representative's information if it's applicable, and a signature. Send this along with the supporting documentation. Any additional documents or records that help your case. Now, a couple slides back, we looked at the 5 different levels of Medicare appeals, and we said that each level has certain steps that have to be taken before appealing to the next level. They also have different timelines associated with them, and they're important to note. We don't expect you to memorize these. We do have tools out there where you can refer back to them. We got several pre-submitted questions pertaining to timeframes and deadlines, so we want to share them with you on these next couple slides. The request for redetermination has to be filed within 120 days from the date of the initial claim determination. This is the date that's on your remittance advice or on the beneficiary's Medicare summary notice. WPS or your MAC, whoever, if you file to different ones, they have 60 days to make a decision once they receive a valid redetermination request. It's important that you don't submit an additional redetermination on the same service during that 60-day period. Duplicate submissions cause unnecessary costs to the Medicare program. They take more time, and repeatedly sending duplicate requests could be viewed as waste or abuse. For level 2 reconsideration requests, you have 180 days from the date of the receipt of the redetermination decision. One thing to note there, if you're requesting a quick review of a contractor's dismissal of a request for redetermination, the time limit for filing a request for reconsideration is 60 days from the date of the receipt of the contractor's dismissal notice. And I know we're not talking about dismissals in this webinar, but that is something to note there since we're talking about timeframes. Please submit your second level request to the appropriate QUIC, and that's going to be outlined in your redetermination decision letter. If you go on to levels 3, 4, or 5, you have 60 days from the receipt of the notice of the previous action. We always like to show resources, places you can go to get more information. I personally love fact sheets, flow charts, cheat sheets, whatever you want to call them, that highlight important information in an easy to use and understand format. So this is a CMS appeals flow chart. I know the screenshot's a little blurry, so let's take a look at it quick on the CMS website. So what it does is it outlines all the 5 levels of appeal along with the number of days you have to file. So it has the number of days to file, and then it also has the time limit for finalization. So here's your first level redetermination. You have 120 days, and the MAC has 60 days to finalize it. So you can see it all here in a nutshell and in one easy sheet. Now it also contains the amounts in controversy, which apply to levels 3 and level 5 for the dollar amounts. And it also has the 935 process on the right-hand side of the chart. Those aren't things that we're discussing in this particular session, but I did want to point them out that they're there also for you. So let's go back to the presentation here. And right now, at this point in time, I'd like to turn it over to Karen. She's going to discuss our next session here. So Karen, please go ahead.
Thanks, Celine. Now, before we get into the question and answer portion of the webinar, we'd like to take a minute to talk about some frequent trends that were identified by the appeals team. Handling these situations appropriately can save you time, frustration, and maybe even decrease workload. So when we look at the data, timely filing rejections consistently land in the top 5. These claims do not have appeal rights, so you wouldn't want to request a redetermination. Now there is action that can be taken if your claim meets certain criteria. CMS has 4 exemptions that constitute good cause for extending the timely filing limit: administrative error, retroactive Medicare entitlement, retroactive entitlement involving Medicaid, and retroactive disenrollment from a Medicare Advantage or PACE provider organization. Now, administrative error is going to refer to an error on the part of CMS or a Medicare contractor. This is not an error at the facility or practice. Now, examples would include a CMS or a MAC employee stating that certain services were not covered when in fact they were, or excessive delays in providing information that was necessary to file the claim. Retroactive Medicare entitlement occurs when at the time of service, the beneficiary was not entitled to Medicare. Then more than a year later, the patient receives a notice from the Social Security Administration that they are entitled to retroactive Medicare, and they have a date their retroactive date is on or before the date of service were received. Retroactive Medicare entitlement involving state Medicaid agencies would occur if the beneficiary was entitled to Medicaid at the time of the service and not Medicare. Sometime after the date the services were received, the beneficiary received notification from the Social Security Administration that they have retroactive entitlement to Medicare. Then to add to that, the state Medicaid agency recoups their money 6 months or more from the date the services were furnished. Our last scenario involves Medicare Advantage plans and program of all-inclusive care for the elderly provider organizations. Now here, at the time services were rendered, the beneficiary was enrolled in a Medicare Advantage or a PACE provider organization. The patient then disenrolls from the plan, and their disenrollment is effective retroactive to on or before the date services were furnished. The previous plan then recoups their payment 6 months or more after the services were received. Now, in each of these scenarios, requests must be sent to the claims manager at the appropriate state-specific address found on our website. Documentation proving good cause would include things such as reports or statements from CMS or your MAC, official letters from the Social Security Administration, verification of recouped payments, and disenrollment notifications. Now, we did get some questions about Medicare secondary payer situations, and those are not considered good cause for timely filing. If another insurance is primary to Medicare, you should still file that claim to us and report that primary insurer payment. That way, if down the road they determine that they should not have paid the claim as primary, you already have that claim in the system and you can make changes to that. Now, Medicare secondary edits are another common rejection seen here at WPS. Here you see rejections for workers' compensation, automobile no fault, and group health plan. These rejections are not appealable, so redetermination requests are not an option. This only causes delays in the processing of your claim. If you are a provider who bills on a UB04 or an 837I, adjustments can be done to correct the information that was originally submitted. Now, if you are a provider who bills on a CMS 1500 or an 837P, then a new claim containing the correct information can be submitted. There are steps that can be taken in hopes of avoiding a rejection altogether and eliminate additional work. If the beneficiary has a workers' comp, liability, or no-fault insurance and the services do not pertain to the diagnosis shown on the MSP record, then add a comment in the remarks field like what is shown here. In order to allow the claim to process as Medicare primary, the comment should be placed in the first line of the comment field. You can also use an admission questionnaire when the patient is admitted or when services are rendered. Now, to make this process easier, CMS has created examples of admission questions for you. These can be found in the CMS Medicare Secondary Payer Manual, which is publication 100-5, Chapter 3, Section 20.2.1. Now, you aren't required to use these questions, but CMS has done the work for you, and it could just make your process easier. The WPS Secure Net Access Portal, or SNAP, also referred to as the portal, can provide you with primary insurance information by completing an eligibility check. This option is available for all users registered for the portal regardless of your access level. The last option shown here is the HIPAA Eligibility Transaction System, known as HETS. And because this option involves electronic files, a trading partner agreement is required. Providers can contact the WPS EDI department for details. Now, Appeals also receives a large volume of requests on paid claims, indicating that the payment is incorrect. Many times the provider states that they feel the claim is underpaid or overpaid, and they don't provide a lot of additional details. After investigation, Appeals has found that around 96% of these claims are actually paid correctly. We have included some tips to help both our appeals department and our provider community. If you truly believe that your claim has paid incorrectly, provide details as to why you feel that way. Is there a certain HCPC or CPT code that you feel paid incorrectly? Provide your calculation details in your request so that the issue can be easily identified. Verify your payment using a web pricer before submitting a request. This slide will provide you with links to multiple tools. The web pricer can be used for claims that are paid under the prospective payment system. Applications are available for each of the facilities shown here. Under the other resources, you can find links that can be used for determining payment for outpatient services and physician or supplier claims. And also, when verifying payment, remember that you need to deduct any pass-through amounts, coinsurance, or deductible from the total amount. Now, did you know that WPS has a survey for those who have submitted a redetermination request in the last 30 days? And your input is crucial to helping us improve our process. Contact information isn't required, but it could be helpful if there are questions regarding your feedback. You can find a link to that survey on the right side of the Appeals Topic Center on the WPS website. This screenshot here shows you the location. Now we have now come to the question and answer portion of the webinar. We had a great turnout for this webinar with many of you asking questions during the registration process. We are going to start with pre-submitted questions, and if there's time, we'll move to those that have been entered in the chat. Now, any questions that we don't get to will be compiled and the answers will be emailed to everyone in attendance. We did find that questions could be categorized into 3 areas, which include submission, documentation, and the overall process. Our appeals experts have prepared their responses, so I will turn things over to them. Ashley, take it away. I'm sorry, Amanda.
Good morning. My name is Amanda Lingle, and I'm a senior analyst in the appeals department. I have 11 years of Medicare Part A experience with WPS, and I'm going to be addressing your questions related to submissions to help provide clarity and the best way to submit your appeal to have it processed efficiently and accurately. You have 3 different options to submit your appeal for Part A: through the portal, through ESMD, which is electronic submission of medical documentation, or through the mail. The most efficient way is through our portal. This puts your case right into the appeal system directly and eliminates the cost of the mailing in your submission, as well as the time it takes to mail it in, wait for it to get to our mailroom, be sorted, and uploaded to the correct area. If you do not have portal access or have documentation that is too large to submit via the portal, you can mail in your request along with paper documentation to support your appeal, or on a CD or flash drive containing your documentation. Once the request is received by the mailroom, they will upload it into the system to the correct department. For Part B, we also accept fax requests, but we do not accept them for Part A due to the amount of documentation that's usually required for Part A claims is much larger and would take too much time and paper to fax. Aline, can you please bring up the slides of the different forms? Aline is going to go through the various types of forms, and I'll provide information related to each one as she's showing them.
I'll just give me 1 second. I'm working on it right now.
Okay, no problem. To eliminate any confusion on where or what documentation is for, please make sure you're sending it to the correct address along with the correct form. And as Aline gets those up, we'll go over the different forms. You can find this information on our website under the correct state if you're appealing an A or B claim, and include the redetermination form request for your correct jurisdiction, and fill out all of the forms to help ensure your request gets to the appeal department in a timely manner. So the first form here that she's got showing is when you submit through our portal. When you fill out all the information in the portal, this is what comes through to us for your appeal request. It'll have all your information, the claim information, your facility information, and under the My Reasons Are, that's where we would like for you to list what you're appealing and why you're appealing it. Again, down there below that slide is the jurisdictions. Make sure you're selecting also if you're a J5 or J8 provider and Part A or B, because the forms are different depending on what jurisdiction and if it's Part A or Part B. If you want to go ahead and continue sliding down. And this one here is an example of a Part A request form. And as I said, you have both Part A and Part B forms. The Part A forms will give you the mailing address for all of the Part A facilities for J5, J5 National. And all of the forms on here, the sections that are highlighted in blue is the information we would like filled out to be able to work your request efficiently. The most effective way to ensure your appeal is going to be worked appropriately is by providing all the information related to the service you're appealing and the documentation that would support your appeal related to that service. Being clear on your request as to why you feel it processed incorrectly helps us make a more accurate decision. If you just note you're appealing HCPC 1, 2, 3, 4, 5 under items and services, but do not list anything as to why you feel this denied incorrectly under the additional information Medicare should consider or the reasons section, we don't know why you feel the claim is editing wrong and why you're submitting the appeal request for the claim line. If the line form does not allow you enough space to list your reason for submitting the appeal, you can note that in this section, see attached letter. If you want to include a letter to provide clarification that would be more descriptive in regards to why you're appealing is crucial to the appeal being reviewed correctly. For example, when you go to the doctor for an issue, you don't just walk in and say, I'm sick, and feel like you're going to get appropriate treatment or diagnosis. Your physician is going to ask you what's going on. How long has this been happening for? What are your symptoms? So that way they can treat you according to your issues. If you just say I'm sick and they don't gather information from you and you don't provide information, you aren't going to get a correct diagnosis or treatment. Same with submitting your appeal. If you just list vague information, we don't know what you are disagreeing with on your claim and why you are submitting your appeal request. So please make sure you are listing all CPTs or HCPCs that you are appealing, address the denial, and be clear as to why you are appealing, as well as only submit documentation pertaining to the service on the appeal request. You don't need to submit thousands of pages of documentation that does not pertain to the specific item or service that you are appealing. So with that being said, I'm going to turn it over to our senior analyst, Ashley McKern, to answer the pre-submitted questions and clarify the documentation that you submit along with your appeal.
Good morning, everyone. I'm Ashley. I'm one of the senior analysts, and I've been with the Appeals Redeterminations Department for about 12 years. We did have some detailed pre-submitted questions regarding documentation and the documentation requirements. So I'm going to be reading those questions and providing answers for them. The first question was, many claims deny for medical necessity, but our coding department and providers state the patient documentation, and coding meet requirements for medical necessity. How should we move forward with the appeal process for these types of denials? So the answer would be to move forward with the appeals process, you will need to submit the documentation along with the appeal request to have our clinical staff review and determine if the records support the services billed were medically necessary, or to possibly verify coding billed on the claim to make sure that the correct diagnosis codes were applied to keep the claim from rejecting for certain reason codes. The next question we received was regarding provider and beneficiary liability on denied claims or services. We weren't exactly sure what this question was asking, so if this doesn't answer that particular question, please reach out after the webinar so that we can provide more clear information. So a service is either provider liable or beneficiary liable, depending on the information billed on the claim. Depending on if the service requires a specific diagnosis code to be payable and the diagnosis code was not billed, then that could be provider liable. But if you are billing for a service you know is not covered by Medicare, you can have the beneficiary sign an advance beneficiary notice of non-coverage, an ABN, at the time of service, and the charges will be beneficiary liable. An ABN would need to be valid and complete, and it would need to be submitted with the appeal request. There is a tutorial on ABNs on the Medicare Learning Network, and that link is going to be available in the chat. One person asked, or maybe a couple people, never know, asked, I need to upload more than one document, but the portal only allows one. How can I upload the rest of my documentation? WPS currently only allows one document to be uploaded with the appeal. However, you can zip multiple documents into one file and then upload the zip file with the appeal. Where can I find the findings letter on the website? You are able to review the status and/or the decision on the portal and retrieve the letter related to your claim if the decision was unfavorable or partially favorable. A letter is not sent out for a favorable decision. The next question, do we need to include a summary sheet with the appeal to indicate what page to find specific supporting documentation? While it's not required to include a summary sheet to indicate what page and where to find specific information on the appeal request, it is extremely helpful for our reviewers, especially when there's a large number of pages submitted with the request. The next pre-submitted question was, is specific wording like IV push versus IV infusion necessary, or is route intravenous with start and stop times included sufficient? You can use whatever terminology that applies to your appeal and are comfortable using. Our clinicians know what is under review, the edit it is hitting, and what to look for in the documentation. What are the credentials of the person auditing? It depends on the edit or audit that's under review. We do have trained staff of examiners that can handle basic appeal requests that do not require clinician review. However, if your appeal does require clinical review, all of our appeals clinicians are registered nurses. What records are needed to support a medically unlikely edit or an MEV denial? You would need to send documentation to support all the units billed were provided, signed physician's orders for the services billed and provided, and any records to support any applicable guidelines or regulations, such as the local coverage determinations, LCDs, national coverage determinations, NCDs, or any CMS IOM for medical necessity. What information needs to be included for an appeal of an inpatient denial claim? The documentation for an inpatient claim denial would need to support the applicable NCD and/or CMS IOM guidelines were met to support medical necessity. You will want to send any documentation that pertains to the claim and/or services that were denied, such as orders, results, procedure reports, etc. And our last question for that's regarding documentation was, what documentation is useful when appealing an ambulance claim, and do hospital records need to accompany appeals for ambulance claim denials? Hospital records aren't necessarily required, but they may be helpful during the review. Otherwise, for ambulance claim denials, the ambulance run reports, physician's orders, certifications, if applicable, can be submitted for review. And you can also find more information regarding ambulance guidelines and coverage in the CMS Medicare Benefit Policy Manual. That's 100-2, Chapter 10 for ambulance services. Now I'm going to turn it over to our other senior analyst, Samantha. She's going to go over the last of the pre-submitted questions regarding the appeals process. Thanks, everyone.
Thanks, Ashley. As Ashley said, my name is Samantha, Samantha Bean, and I'm also a senior analyst in the appeals department. I've been with WPS in the appeals department for 17 years. I'm going to be going over the whole process of an appeal pretty much, from kind of the beginning to the end of a redetermination. So when you receive your remittance notice or you check your claim status on our portal and you do not agree with the denial or you do not agree with the payment, you pretty much have the appeal right on that service. There are certain instances where you may not have an appeal right and your remittance notice will tell you that. One example of something you don't have an appeal right on would be if it has the remarks code of the N211. And that just tells you, alert, you may not appeal this decision. So pretty much as long as you don't have that or something on your remittance telling you that you cannot appeal, you have appeal rights on that. When you send in your appeal, we do prefer that you send in only one ICN per redetermination request. There are very rare instances where we would want multiple ICNs on one request, but again, that's a very rare. One instance, just as an example to give you, is our Unified Program Integrity Contractor, our UPIC. If they do a post-pay review and they do multiple overpayments for the same reason, we would want you to send that in as one request. But other than that, we want it one for one. And actually, our portal only allows you to do one for one. And that's honestly the easiest, and I would think probably the easiest for you as well. We already went over this before, but I'm going to go over the options you have to send in a redetermination. The most efficient way is, of course, our portal. Whenever you submit your redetermination through the portal, you'll pull your claim up. Whenever you decide you want to appeal it, there's the option, you want to submit a redetermination. And the portal will pretty much fill everything out for you. If it denies without appeal rights, a lot of times the portal will not let you appeal that claim. It tells you that you do not have appeal rights. So at that point, you would either want to follow what the portal says. A lot of times it'll give you instructions on where you can go on our website. So you'll just want to follow that. Or if you have any questions, you can always call our customer service line as well. You can mail in your redetermination request. And of course, our electronic submission of medical documentation, the ESMD, and then for Part B, you can also fax it in. Once the appeal is received in our system, we have a system that manages all of our documents that will route the work to our department. We do have separate queues for our Part A work and our Part B work. Our Part A claims are processed in a system called the Fiscal Intermediary Standard System, or the FIS. And our Part B claims are processed in the system called the Multi-Carrier System, or MCS. Since they're processed in separate systems, we do work them separately. Once you submit your appeal request, you do have the option, if you submitted it on the portal, to check the status of your appeal. At this time, the only thing that you can check, the only thing that the portal will show is if your appeal is still in process or if it's completed. Those are the only two options right now. I know this has been discussed before, but we do have 60 days to process your appeal. So once you do submit your appeal, we do ask that you do give us the 60 days to process your appeal. For the most part, we do work our cases in the order they are received. It's first in, first out. There are, of course, instances where we may need to expedite something, and we will if we need to, based on, CMS guidelines. But for the most part, we do just bring them in, first out. So our redetermination staff will work in the system, whether it's Part A or Part B, and they will pull a case into their queue or will assign it to themselves, and then they'll start reviewing it. The first, I'm going to kind of go through just a brief overview of what we kind of look at whenever we do a redetermination request. Again, this is just an overview. This is not everything. All inclusive. It's just brief. So first thing that we'll want to look at is this a redetermination request, or is it something that possibly needs to go to another area? Is it something that denied for no medical records? You know, we would send that to our claims medical review department if it did. If you sent it in the portal and we sent it to another area, and it's Part B, we would notify you in the portal that we sent this to another area. We would tell you where we sent it to. Then at that point, that other area is going to respond. If you did not send it through the portal, you will not get a response to us. A response from the appeals department, if we send it to another area, you will only get a response from that other area. Whether it be a remittance notice with your new denial or your payment of the claim, or, you know, a letter from them, or maybe even a phone call. If we've determined that it is a redetermination request, the next thing that we ask ourselves is it a reopening? Is it something, you know, is it just asking to add, change, or delete something from the claim? At that point, you know, we'll process it. Even if it's sent in as a redetermination, if it is a reopening, we will process it as a reopening. If we determine that it is a redetermination, we'll look to see, has this already had a redetermination? You know, if it has, and we'll look to see if you're asking for a reconsideration, which is the next level of appeal. If you are, then we'll go ahead and forward that on to them. We do ask that you do not send those to us. We will forward them on if you do, but there is a process out on our website to send cases to the QIC, as well as instructions in your letter that we send out that has the address and everything that you need to send that to. If we've determined that it is a redetermination and it hasn't already had one, we'll look to see, is it timely? Is it complete? Do we need to develop for documentation? It's not very often here at WPS that we develop for documentation. Pretty much the only time that we do is if it's a beneficiary request, you know, if the patient sends in the request, or if CMS gives us specific guidelines and tells us, for this service, you need to ask for documentation. Other than that, we would expect you to send in anything that you would want us to review at appeals level. The next thing we would look at is, does the claim require medical review, and is there documentation attached? How we determine if it requires medical review is we look at our LCD and our articles. That will tell us a lot of times. The IOMs or the NCDs will tell us, you know, that our medical review staff needs to review it at appeal level. If we do determine that it needs to medical review at appeals level, we will send it to our clinicians. The clinicians will review the documentation, the CMS guidelines, to determine if the services are payable or not. For Part B, they send the cases back to the redetermination rep, and they will finish working the case, whether it's unfavorable, partially favorable, or if they're going to pay it. For Part A, our clinicians will send the letters. How you know if a clinician's reviewed your claim, you'll only be able to tell this on a unfavorable or partially favorable. There will be a sentence on your letter telling you that your decision was based upon the medical review staff. If the claim doesn't require medical review, then the redetermination rep will make their decision based on the CMS guidelines using the information you've provided. This is where it's very important that you tell us why you do not agree with the denial. They'll review that information as well, and they will take that into consideration. If your decision is favorable, we will adjust or effectuate your claim at that time. We have 60 days to finalize the adjustment. Once the adjustment finalizes, you'll receive a remittance notice. For those of you that did not submit through the portal, that will be your notification of your decision. For those of you that submitted in the portal, you will receive a favorable decision in the portal. If your decision is partially favorable, again, we will adjust and effectuate the portion of the claim that can be paid. Again, we have 60 days. And then you will also receive a letter. For those of you that submitted in the portal, your letter will be available in the portal. If you did not submit it through the portal, then it will be mailed out the following business day, and you'll receive it in the mail. And that letter will explain what we paid, what we didn't pay, and why we paid what we did and why we didn't pay what we didn't. If your decision is unfavorable or if we dismiss your appeal, then you'll receive a letter from us. And again, just like the partially, if it's submitted in the portal, you'll get it immediately in the portal. If it's non-portal, then it'll be the next business day we'll get it mailed out. Okay, and then one thing I did want to notice for Part A letters, we mail those out whether you submit those in the portal or not. And we have noticed that sometimes there is an issue with viewing those letters in the portal. Sometimes it'll give you an error. We get those from a third-party entity, and it just sometimes causes issues. So we just also mail those out. So know that if you do get an error in the portal, that you will also be receiving a letter in the mail as well. I did have some specific questions as well. That was the end of the process of an appeal. That's pretty much all of it from beginning to end. I did have some specific questions that I'm going to go through now. We had a question about when your claim is medically reviewed at claims level and you get the denial and you determine, or the payment, you determine that there was an error in billing. Once a claim is reviewed medically at claims level, that claim cannot have a clerical error reopening on it. So if you need to make any changes to that claim, you will need to submit a redetermination request. You'll need to submit your documentation. You'll need to tell us what you're wanting done to the claim. And our medical review staff will need to review that to make sure that those changes can be made. Another question that we had was for prior authorization. Medicare does require prior authorization for certain procedure codes. You can appeal claims that deny for prior authorization, but there are only a couple of situations where we would overturn without prior authorization prior to providing the service. And that is when documentation shows the beneficiary is retroactively eligible for Medicare benefits at the time the beneficiary received the service, or if the services were performed in an emergency setting. And we would expect those to not be billed as outpatient, but it could happen. So we would just need documentation supporting one of those two things. Another thing with prior authorization is exempt providers. So hospital outpatient departments, or OPDs, that demonstrate compliance with Medicare coverage coding and payment rules related to prior authorization may be eligible for exemption. This exemption would remain in effect for a 12-month period or until CMS elects to withdraw the exemption. Notice of exemption or withdrawal of an exemption will be provided at least 60 days prior to the effective date. We do have information on the exempt process, and Karen, if you can put that website in the chat, I would greatly appreciate it.
Samantha, I did get that put in the chat, and I'm not sure, we are getting really close on time, so I am going to have us take the rest of the questions that did not get answered. We're going to submit those out to everybody. We'll send emails to everybody in attendance, so you will get all those answers. But I just wanted to get things closed out so that we don't have anybody over time. I also want to thank Amanda, Ashley, and Samantha for all of your great work in answering everybody's questions. Thank you so much for all of that. There are a couple slides here just providing you with some resources. We won't go through all of these, but we have one for WPS and we have one for CMS. Now, when you disconnect from the webinar today, you are going to be redirected to a CMS survey. Survey is going to be to provide feedback on how Aline and I did today. The redirect does look like what you see here on the right. Now, we do not have any control over how this appears, so we just want you to know it's not spam, it's nothing malicious, it is the CMS survey. That does bring us to the end of today's presentation. On behalf of myself, Aline, and the WPS Appeals team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.